I'm now joined by Tara, who's a regional advisor on tobacco control in the Asia-Pacific region. Tara, welcome.
Thank you very much, sir.
Thank you for coming and speaking to us today.
Yeah, it's my pleasure.
Now we're talking about pictorial warnings on tobacco products. Tell us exactly what are those?
When we say the pictorial health warning, it's about the health education, information and communication. How to inform our people, mostly the uneducated people, about the danger of tobacco use. When people see the pictures, it's easy to perceive and it's easy to understand. And for example, what is the problem now? The problem of tobacco is the use in the Asia, especially in the countries where the population is quite big, like China, Indonesia, India, Myanmar, there are other countries like Russia and many other countries. Okay, so in those countries, the government is facing not only the health problem, but also they are facing the issues in other development sectors. So they need money for the development. They need money for socio-economic sectors. They need money in the education sector. Also, government needs the money in health sectors. So resources are always limited. So how can we make the limited resources effective at the developing settings? That's the tobacco control. Why tobacco control? Tobacco control doesn't need the huge money. It needs the political commitments. It needs the action. It needs the action at the ground level. It needs the people's participation. How can you build the people's participation in tobacco control? That's first we need to educate them about the danger of tobacco. That's why pictorial health warning is one of the most effective way to build the people's participation in tobacco control initiatives. Right. It tells the real danger to the people.
You're obviously a big advocate for pictorial warnings, but tobacco companies obviously don't like pictorial warnings. Is there not a threat of legal action against governments that take this course?
The action, the Nepal is one of I think the first country in the world which has the highest the size of the pictorial health warning, that is 90%. So now tobacco industry, they sue the Ministry of Health and the government as a whole. They simply say pictorial health warnings are not effective anymore in US settings or in other developed countries setting like Canada. But that's not true. If they say like this, it's very effective, in a public health program. A pictorial health warning is the best by public health intervention to promote the health awareness among the peoples. So it's cost effective. It has the huge impact to gain the people's awareness and to gain the people's support on tobacco control initiatives. So again and again, I would like to highlight it's a best buy for the government.
Well, Tara, thank you very much indeed for joining us.
Thank you very much. Thank you.